They're the unforgettable faces of the pandemic. Doctors and nurses fighting to save lives, wearing medical masks for hours and hours. But while those imprints will go away, after a year on the front lines, for many, the emotional wounds of COVID-19 run deep.
We are not okay. We are tired and we are scared.
Please, 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 wear your mask, social distance.
From pleading with the public to do the right thing to sitting at countless bedsides as patients died without family or friends.
To hold these hands and bear this weight and do what we do, and then to come home and to have to hear people say it's not real, it's undescribable.
Rachel Ellsworth has been a nurse for 12 years. She worked the COVID unit at a hospital in Florida.
There's so many names and faces that are flashing through my head.
Each death has taken a toll.
I had one patient in particular who you could tell he was like the papa bear of his family. He'd say, what do you need me to do? I'll do anything. I literally do whatever you tell me to do. But you can't let me die. My wife needs me. And that was one. That's one.
How do you make sense of this, the sheer volume of tragedy that you've seen?
Sometimes you don't. Sometimes you don't.
Dr. Tawn Neville is an ICU physician at UCLA's Ronald Reagan Medical Center. She says because of her work fighting COVID-19, the depression she's battled for most of her life has gotten worse.
I've had a lot of difficulty sleeping just because of anxiety and replaying stories in my mind. I've had the early awakenings, and it's been a difficult journey, to say the least.
Ellsworth and Neville are far from alone. A survey of more than 1,100 healthcare workers found emotional conditions comparable to a war zone, with 86% experiencing anxiety, 76% reporting exhaustion and burnout, and 70% say they now have trouble sleeping.
I myself have asked for help. I think it's important that we are recognizing that this is not a sign of weakness to ask for help. It actually is a sign of strength.
Dr. Vineet Chopra is the chief of hospital medicine at the University of Michigan.
Do you think that there is a mental health crisis looming within our healthcare system?
I don't think there is a mental health crisis brewing. I think it's here. And I think the fallout is still to be determined.
According to a survey out this week by the American Nurses Foundation, almost 20% of nurses intend to leave their position, although the vast majority say they plan to stay within the profession. Eventually, Ellsworth, a mother of 3, had to step aside. She says she grew irritable and was having trouble getting out of bed.
I stepped away to protect my own mental health and to protect my children's childhood because they weren't getting the mother they deserved.
While Dr. Chopra foresees short-term healthcare shortages, there is a silver lining.
For everyone leaving, I know of people who are now more committed to joining healthcare. There's this incredible call to arms where people really wanted to sort of contribute and be part of that change.
Dr. Chopra says there are things you can do to help our healthcare workers. If you see a healthcare provider, thank them. And if you have friends or families who work in healthcare, check in on them. See if they're okay or want to talk. Gratitude and caring goes a long way.